Hi, I am Dr. K Madhusudhan, lead consultant neurologist and head of the Department of Neurology, Aster RV Hospital, Bangalore. As you know, a lot of memory problems are occurring recently in patients with elderly patients. So there is an entity called as Alzheimer's disease, that's called as dementia. See, all dementias are not Alzheimer's, but some of the dementias are called as Alzheimer's disease. This is caused by non-treatable condition because Alzheimer's is a neurodegenerative disorder which occurs due to the accumulation of abnormal proteins in the brain, which leads to the damage to the nerve cells, especially in the memory area of the brain. See, brain has got a memory area like we have a hippocampus, amygdala, temporal lobe. They are all the areas which are concerned with memory, especially the left side of the brain, that too in the left temporal lobe. Pathologically, it is caused by accumulation of abnormal proteins called tau proteins or neurofibrillary tangles, which is due to the accumulation of the tau protein and beta amyloid protein in the brain, which leads to the oxidative stress to the brain cells and damage to the nerves. Ultimately, the process of thinking, thoughts, executive functions and routine daily activities will get affected to the patients. They are not able to remember most of the recent events. However, the remote events or past very long-term memory can be preserved in these patients. There are a lot of risk factors for this. Age itself is a risk factor. Sometimes there can be genetic factors also, like ApoE proteins, ApoE accumulation can also cause this. So like that, if there is a family history of Alzheimer's disease, also can land up in memory problems in future. And many of the time the cause is not known. And what are the treatment options available? Treatment for the patients is very important to prevent the faster degenerative of the nerve cells. Lot of medications are available called donepezil is available, memantine is available, and many of the antioxidants, coenzyme Q and nerve vitamin supplements are also given to these patients. When we do the neuropsychological assessment, we come to know what is the amount of brain cells which is damaged, or what is the amount of which are the areas of the brain functions which are involved in this memory disturbance. At the same time, the caregiver also should get educated about the Alzheimer's disease, because caregiver also is very important for giving the medications to the patient, because they are not able to take the medicines by themselves in the end stage of the diseases or in the moderate to severe dementias. So financial burden also will be there on the caregivers. Ultimately, caregiver education is also very important. So all of us should strive hard to prevent this Alzheimer's disease. Also, we have to do the campaigns to prevent Alzheimer's disease in the community. Thank you.